Welcome and thank you for attending our Security Health Plan Life Focus webinar exclusively for our Life Focus employer groups. My name is Angie Pirro and I'm a health educator with Security Health Plan's Life Focus program. Before we get started, it's important to mention that the information provided during today's webinar is designed for educational purposes only. It is not intended to be a substitute for informed medical advice or care. You should also not use this information to diagnose or treat any health problems or illnesses without consulting your provider. Please consult a doctor with any questions or concerns you might have regarding your personal health. A few housekeeping items before we begin. Remember to have your speaker's volume on your computer turned up, and to ask any questions during today's webinar, please use the questions tab on the control panel. We will encourage you to monitor and use the chat feature where we will discuss today's webinar topic. And towards the end of the webinar, we will also take those questions directly to our presenter today. Shortly following the webinar, you will have the opportunity to provide us feedback on today's presentation. So we encourage you to take a few moments to complete this evaluation and let us know what you think. If you are participating today as part of a workplace wellness incentive program, please keep in mind that if you are viewing the presentation as a group, you will need to contact your wellness representative to learn more about how to confirm your attendance. Today's webinar is entitled Facts on Cancer in Wisconsin. So, and well, I should say, back up one step further, being October, being Breast Cancer Awareness Month, it seemed rather fitting that this presentation came at this time. And we're very fortunate to have with us today Beth Brunner. She is the Wisconsin Healthcare Partnerships Director for the American Cancer Society. And she's been with this organization for 15 years. So her experience is one that probably puts her into the expertise field as far as what she can share with us today. So we're very lucky to have her. She's going to be sharing with us a lot of information that's actually hot off the press, so we're excited to hear that, and also talk a little bit more about the incidence and prevention of cancer. So with that, I'm going to pass it over to Beth. I want to thank you, Beth, for being here with us today. And again, please keep all your questions in mind and share them with us, because we will be bringing them to Beth towards the end of the presentation. So with that, Beth, I'm going to turn it over to you.
Great, thank you, Angie, and good morning, everyone. As Angie mentioned, I am with the American Cancer Society, and my role here really focuses on providing education and partnerships with healthcare systems across Wisconsin. Most recently, we just completed the 2013-2014 Wisconsin Cancer Facts and Figures that's going to be released this month. So that's what Angie was mentioning. It's something that I incorporated a little bit into this presentation. So kind of the hot off the presses really hasn't even gone to the press yet. It's there right now, and will be there very shortly. So some really good, timely information, not only for Breast Cancer Awareness Month, but just overall information. So today we're going to have 3 objectives. So it'll be perfect, understanding the impact of cancer in Wisconsin. So this is where I'm just going to provide a little background information so people are aware of what it looks like in the state of Wisconsin and to the residents here. Talk about ways to prevent cancer. So what are some of the ways that we know that we may be able to reduce our risk of cancer? And third, really going back to how to detect cancer early through screenings. And all of these are going to be incorporated together, so you may hear them throughout, but really those 3 main objectives that we're going to see for today's call. So on the next slide, it just is going to begin to give that overview of what does cancer look like in Wisconsin. So in 2013, it's estimated that over 31,000 Wisconsin residents will be diagnosed with cancer. And that means 87 people a day will hear the words, "you have cancer." The chart here gives just an overview of what does the breakdown of the new cancer cases look like in Wisconsin. So you're going to see the biggest pieces on the chart are going to be female breast, prostate, and lung cancer. So those are really, when you look at the most diagnosed cancers in the state, it's going to be those 3. Now on the next slide, we talk a little bit about the cancer deaths in Wisconsin. So in 2013, over 11,000 residents are estimated to die from cancer, and that's going to mean about 31 people a day. Here you're going to see a little bit of a shift. So where lung and bronchus cancers represented 14% of the new cancer cases, on this slide you see that they'll represent 27% of all cancer deaths. So a little shift, and you can definitely see those cancers that have the higher number of cancer deaths. Rolling into the next slide, I wanted to show just overall in men and women what are the cancers that are most diagnosed and those that are causing the most cancer deaths. So on the left-hand side in this slide, you see are the new cancer cases in men, and this is just in males for the first one here. So you're seeing 28% of all cancers diagnosed in men are prostate cancer. But you can see then when we're looking at cancer deaths, you're looking at a higher percentage in lung cancer of those men that are diagnosed. So just some interesting information. So you can see down the list that you're looking at colon and rectum, you're looking at bladder, you're looking at a non-Hodgkin lymphoma, melanoma, pancreas, or other not only top diagnosed cancers, but those with the most cancer deaths. And then on the next slide, it'll show females. So the same type of chart, you're looking at new cancer cases on the left, and you're looking at the percentage of cancer deaths on the right. You're seeing breast having the most frequently diagnosed cancer in women at 29%, and very similar to males, you're seeing in females that lung cancer has the largest percentage of cancer deaths. So in the next area, I just wanted to focus real quickly on cancer incidence, and that's really looking at the number of new cancer cases. The next slides I'll just say are kind of they might look like a lot of numbers, but I'm just going to the year 2010. So the two I've highlighted I think really are things that we're going to watch here in Wisconsin. So one of them is colorectal cancer. So over the past 15 years, we've seen almost a 40% reduction in the number of the colorectal cancer incidence rates. So we're definitely seeing a positive trend here with the reduction by almost 40%. When we look down at the other circled number, which is melanoma, we're seeing an 83% increase in incidence rates, which is telling us in melanoma that we definitely have a trend we want to start watching, because you want to see more like the colorectal cancer rates where they are going down versus kind of that upward trend. The next slide shows the state of Wisconsin, and I think people sometimes just want to see, hey, what does my area look like? And we can do that very specifically for counties throughout Wisconsin. So what this is showing is those counties that are shaded have a higher cancer incident rate than the state average. So we talk about cancer incident rates versus new cancer cases because then you can do a comparison similar to this. So because populations are different in each county, if you did just the number of cancer cases, you wouldn't be able to compare because some counties have much larger populations than the other. So when we do an incident rate like this, what we're doing is we're evening out the consideration of population, and we're also doing an age adjustment. So there are some counties that are going to skew in older populations versus younger populations. And they also, when we do an incident rate, we account for that. So this can be a somewhat, a more accurate measure if you wanted to do a comparison of counties to counties. I will say that on the far left-hand side, some of those St. Croix, Pepin County area, some of those cases are diagnosed in Minnesota. So we may see a lower incident rate there just because we may not know about the cancer diagnosed, but it's usually only just those few counties on the left. Next, I just wanted to do the same kind of overview in cancer mortality so people can see what we're talking about when we look at mortality or the number of cancer deaths. So on the next slide, you'll see a very similar chart to what we saw earlier, but this is going to be the mortality rates. And the one I started off highlighting is I think it shows a very interesting, if you look at the yellow highlighted, it's a very interesting trend we're seeing. Is over the past 15 years again, so we're looking 1995 to 2010, at the lung cancer mortality rates, we saw a decrease by almost 20% in the male cancer mortality rates, but we saw an increase in the female cancer mortality rates for lung cancer. Now, what's really interesting about this is we see that the lung cancer mortality rates somewhat mirror, by almost 30 years, the increase in tobacco smoking. So what we saw 30 years ago is that men were starting to level off and decrease the amount of men that were smoking. But we were seeing an increase 30 years ago in the number of women that were smoking. So that was, the early to mid 80s where we were seeing the slim cigarettes for women, and we were seeing more advertising driven towards women, and we were seeing that trend of women smoking more. So it's very interesting how we can see something like this where we're seeing the trends almost mirror where we were at with smoking rates. And so we see that direct correlation. I will mention, though, that men lung cancer mortality rates is still higher than women. So even though it's coming down, we know that there's still a higher rate there. You can also see that the women's over the past several years has begun to level off. And that very well mirrors what we were seeing with smoking rates about 30 years ago. So hopefully this will both be on a downward trend even more over the next 15 years. But just I like to point that one out. It's kind of an interesting thing we see here in the state. Good things, really good things we see. One is going to be this colorectal mortality rate that, again, is going down by almost 36%. Great to see a line like that, and I'll talk a little bit more about what, the impact that has. But also down at the bottom, we're going to see female breast, cervical cancer, and prostate cancer, all mortality rates decreasing in large numbers. So that is all trends we love to see because these are screenable cancers. So we know not only are we getting people screened and detecting it early, but we're also improving treatments. So again, you're going to see on the next slide, very briefly, I'll just show it to you. It is the state of Wisconsin again. Same thing we saw with incidence rates, but this is just the mortality rate. So we're going to see the ones with the higher than the state average are going to be shaded in that kind of bluish color. And the numbers are on there too, if you can see them. So what does all this mean? So rolling into the next one is going to be just cancer prevention. And this is going to be, I'm going to talk kind of on a nationwide now on what do we know about how to reduce an individual's risk of cancer. So we have some great information, and one of it I'm going to start with is just what are the causes of cancer deaths in the United States. So this is showing you, we know, I would say most people probably know that tobacco is a major cause of cancer death. But what people are sometimes surprised by is that diet, obesity, and sedentary lifestyle is really a high level, 30% of it is attributed to cancer deaths. So we are trying to make sure people are aware that it's not just tobacco that we need to look at, but it's really this diet, obesity, and sedentary lifestyle which is causing cancer deaths. People can think of family history, you can think of chemical exposure, outside influences, but really making people aware that there are some lifestyle changes that we may be able to make to really help people decrease their risk of cancer. So on the next slide, I just want to touch on tobacco. So tobacco use is the single largest preventable cause of disease and premature death in the United States. So not just lung cancer, but heart disease, emphysema. We know there's more than just lung cancer. In Wisconsin, we have 19% of adults report current cigarette smoking. We know the trend is going down, so we like to see that. But we still see the largest percentage of adult smokers is that 18 to 29-year-old age group. We know also that the majority, if not almost every smoker, starts when they're a teenager. Very few people pick up the habit as they get older. So this is where we want to look at what are the trends of high school students too. So approximately 15% of high school students reported smoking at least one day in the past 30 days. So on the next slide, you'll see the trend of cigarette smoking over the past, 10 plus years is really going down. So that's great to see because about 10 years ago, we really started some interventions with youth to try and educate them on preventing them from starting to smoke. We passed smoke-free air laws, which was really trying to make it unappealing and inaccessible for people, for youth to smoke. And there was an increase in the cigarette tax to try and make it expensive for kids to start to smoke. So this is a trend we really want to see. A new trend we are watching is that although cigarette smoking is really going down in youth, cigarette smoking or cigarettes are regulated. Products like small cigars and some smokeless tobacco products are not, and the increase of those is becoming a little alarming for public health. So what we're talking about is these small cigars. They're called dissolvable orbs or dissolvable strips that are becoming popular. And one of the reasons they're becoming popular is because they're fruit flavored. You can buy a grape flavored small cigar. You can buy a dissolvable tobacco strip that's flavored like bubble gum. So this is something in a new area that we really need to watch because it's not regulated like cigarettes. And where we're seeing a decrease in cigarette smoking, we are seeing an increased use in these other products. So just something, if there's parents on the phone or anybody interested in it, I think that's going to be a really interesting one for us to watch. The next piece I wanted to talk about was just that nutrition, physical activity, and obesity. So as I said, 1/3 of cancer deaths that occur are really due to poor nutrition, physical inactivity, and excess weight. So in Wisconsin, we're looking at 37% of adults are overweight, 27% of adults are obese. But what we want to watch is that the percentage of overweight and obese adults are increasing. So something for us as a community to look at is really how are we increasing access to affordable and healthy foods in the communities, in our places of work, in our school. How are we decreasing access or decreasing the marketing of foods with maybe low nutritional value, especially to our kids and youth? And the third is really how are we providing safe, enjoyable, and accessible environments for physical activities in schools or in workplaces? And how just in the community are we making safe trails and recreational facilities for the kids and adults in our communities? So next, just really quick, we have some guidelines that individuals can look at too. So we want, achieving and maintaining a healthy weight, which goes directly back to that last slide of the community. So if the community can support somebody who would like to maintain or achieve a healthy weight, it's really getting out and exercising and balancing that caloric intake. Adopting that physically active lifestyle, we want people to be physically active above and beyond what they do, but we know days are busy and lives are difficult to balance. So, it doesn't have to be strenuous exercise every day, but anytime you can get out and do that above and beyond your normal everyday routine is great. The other thing is we want to see children and teens get at least an hour of moderate exercise every day. We know they're trending the same way our adults are in being overweight and obese. Plus, kids and teens just need to be active. So we really want to support that, whether it's in a community or in a school. How do we help kids stay active? For foods and beverages, we want people to make healthy choices there, choose whole grains, limit consumption of processed or red meats, and alcohol consumption. We know that there not only can it lead to some excess weight, but it also can lead to some cancers consuming alcohol consumption. So we want to look at no more than 1 drink per day for women and 2 drinks per day for men. And this is really per day. I have had the question of if I do not drink during the week, can I have all 7 of my drinks on Saturday? No, it is really that wanting to limit the consumption and not have that kind of excess drinking all at once, which is what we've seen to be some of the problems. So I just want to briefly mention, because it's something great that's coming to the Wisconsin area, and just so you know, how do we know this information? How do we know how to prevent cancer? And it's the American Cancer Society since the 1960s has been doing a cancer prevention study. So they have had 2 to 3 cancer prevention studies that are showing how we know that tobacco is a cause of lung cancer, how we know that 1/3 of cancer deaths are caused by excess weight and physical inactivity. So on the next slide, I'm going to touch briefly just on a thing called our Cancer Prevention 3 study. So we are starting our 3rd cancer prevention study. It's a nationwide study. It's enrolling 300,000 individuals. And for those that are interested, I would just say at the end of October, there are enrollments in the northern part of Wisconsin. I should say the northern half of Wisconsin, Marshfield, Wausau, Eau Claire. For those that are interested, going to our website, cancer.org, and just finding out information, or email me if you're interested. I just wanted to touch on it as we talk about prevention because it's a great opportunity to get involved if you're interested. Next, I'm just going to touch on site-specific cancer. So we kind of talked about the prevention, and I'll continue that here. But I also want to touch on screening for our major cancers. What are we looking at, not only for the prevention, but screening for these cancers? So lung cancer is the leading cause of cancer death in Wisconsin for both men and women. More than 87% of lung cancer deaths are caused by tobacco use. The other thing I just wanted to mention is we've seen some connection between radon and lung cancer. So I know in Wisconsin is one of the places where we do see radon in our soil, and our Department of Health Services in Wisconsin has some great resources if you're interested. But I just like to mention it to people that we are seeing it, and it is estimated to be the second leading cause of lung cancers. It's a long time exposure. It is not a 2-day exposure. So this would be something, if you have it in the basement or get it checked, I would say I just like to let people know that this is something we're seeing more and more of. Now, when we talk about screening for lung cancer, up until this year, we really did not have recommendations of what we could do to try and find lung cancer early. There was a nationwide national lung screening trial that just released their results, and with that, we've been able to develop guidelines for those to be screened for lung cancer. This is going to be for people that have been heavy smokers. So this will be people that, what we say, have a 30-pack year smoking history. So it's people that have smoked at least 1 pack a day for 30 years, or 2 packs a day for 15 years, anything that kind of equals that 30-pack year smoking history. And what they've seen is that the lung cancer mortality reduction is with a spiral CT. So I know that there was some conversation about chest x-rays and could that reduce, but that's not been seen to reduce the mortality. It's really been with the spiral CT. So individuals that may fit those kind of smoking history, talking to their doctor and seeing if they would be an appropriate person to get screened. So there is now some screening guidelines coming around lung cancer for those that are interested. The next one I wanted to touch on is colorectal cancer. So screening tests for colorectal cancer not only offers a powerful opportunity with the early detection and successful treatment of colorectal cancer, but it can actually prevent the disease. So this is one that I find really fascinating, that we actually have not only a screening tool to detect it early, but can prevent the disease by removing precancerous polyps that will then not develop into cancer. So in Wisconsin, colorectal cancer is the second most commonly diagnosed in men and women combined. A personal or family history of colorectal polyps or colorectal cancer can increase an individual's risk. And increased screening rates for colorectal cancer have led to declining incidence and mortality rates in Wisconsin for the past decade. So where we were seeing that big decline at the beginning of the presentation, that almost 40% decline in incidence and mortality rates, if we look at the next slide, this is the increase in screening rates. So people who have had that the screenings, you've seen it gone up over the past almost 15 years again. So this is what we love to see, because it's really showing us that the screening is working. The more people getting screened, less people are being diagnosed with cancer, and the less people are dying from colorectal cancer. The next slide, I just want to go over our screening recommendations for colorectal cancer. These can be a little complicated. So I would say, what we want to say is, age 50, we recommend men and women of average risk should start being screened and talk to their physician. These are people at average risk. As I mentioned, people that have a personal history of polyps or have a family history of colon cancer or polyps want to talk with their healthcare provider earlier if they need to start screenings on a different schedule. So this is people of average risk with no symptoms. They have options. So we have lots of options. We have a flexible sigmoidoscopy or a colonoscopy, but we also have options such as a fecal occult blood test. So that can be done annually. And I know it's a difference of opinion on what people are most comfortable with. So some people really feel comfortable with the colonoscopy and the procedure, the preparation that needs to happen to have that complete. Some people say, you know what, it's not for me. I would rather take a less invasive test, and that's good too. So we really want people to know that the best test is the one you get. So here are just some different options on what you can get. I will say though, with some of our screening tests at the bottom that you would do annually, so an FOBT or the fecal occult blood test, if those come back positive, a colonoscopy is recommended. So we are going to see people that may be screened, have positive results, and then will need a colonoscopy. So that could be a possibility. But definitely lots of options with this, and talking with a clinician about the one that's best for you. Next is breast cancer. So we're in Breast Cancer Awareness Month, and there's lots of information. So I'm just going to touch on it briefly here. But breast cancer is the most common cancer diagnosed in women. And the majority of breast cancers can be treated successfully if detected early. So breast cancer accounts for nearly 1/3 of all cancers. So that, kind of among women. But here as we talk about screenings, and I know there's lots of discussion around mammography and when women should be screened. Here's just the 96% of women who develop breast cancer are age 40 and older, and 80% are age 50 and older. So we hear some stories of younger women diagnosed, and those are very important to pay attention to. And as we roll into our screening guidelines, we at the American Cancer Society recommend that annually women should get a mammogram starting at age 40. So on the next slide, we will have all of the screening guidelines. Perfect. All of the screening guidelines. So we're looking at those annual mammograms starting at age 40. And this is, again, at average risk. So some women may need to be screened much earlier than 40 because of a family history or a personal history that they need to discuss with their clinician. So we want to see those yearly mammograms starting at age 40. We also want to see women getting clinical breast exams starting in their 20s. So it should be performed anytime they're having a routine health exam up until age 40. And then at age 40, a clinical breast exam should happen every year. Self-breast exams. Now that is an option for women starting in their 20s. And when I say it's an option, meaning an exam, a self-breast exam, what I don't think is an option is for women to really know their body and report change to their healthcare providers. That is the most important thing. Whether women choose to do a schedule and keep with self-exams, or if you just are very comfortable with what's going on and knowing any changes in your breast tissue and reporting those immediately. I think that's the most important part, and women with anything that changes in your body, your breasts especially, if there is a change, reporting that to your healthcare provider. For the men, next we have prostate cancer. And it is estimated that about 1 in 6 men in the U.S. will be diagnosed with prostate cancer. The most commonly diagnosed cancer among men, and about 2 out of 3 prostate cancers are found in men over age 65. Our screening guidelines on the next slide, starting at age 50, men at average risk should make an informed decision with their healthcare provider. So this is really men at average risk. What might increase a man for their risk of cancer would be African American men or men that have had a father or a brother that have had prostate cancer. Those individuals should probably start talking in their 40s with their healthcare provider. Really quickly, melanoma, as I mentioned earlier, we are seeing an increase in those cancers in the state. So we want people to really begin to pay attention to melanoma. Although melanoma accounts for only 5% of skin cancer cases because there is a non-invasive basal cell and squamous cell, it accounts for approximately, it accounts for the vast majority of cancer deaths. So on the next slide, I just want to point out to individuals recommendations for your prevention of skin cancer. We're going to look at limit or avoid sun exposure during those big peak times. Wear sunscreen at least 15 or 30 SPF or higher. And I want to emphasize children should be protected. They have seen the importance of those sunscreen protection in children protecting them from their sunburns, because they're seeing a connection between sunburns in children and increased risk of melanoma. So I think that's an important place to remember. Next slide, the ABCD rule. If you haven't heard about this before, it's really hard to look or report an unusual sign that may be melanoma. So you're looking for the ABCDs. You're looking for a mole or a growth that may be not be asymmetric, so one side doesn't match the other. The border may be irregular, the color doesn't match, and the diameter is larger than 6 millimeters. So those are your ABCDs, and reporting any changes to your doctor. One last area to talk about is cervical cancer. Cervical cancer it really begins in the line of cervix, in your cervix. And this is another one where you have precancerous cells that turn into cancer. So not only can you detect it early, but this is one, again, like colorectal, where you can catch those precancerous cells. This is also an area where 2 vaccines have been approved for the prevention of the human papillomavirus, which causes most cervical cancers. Last slide here is going to be on the guidelines for the American Cancer Society's early detection. This is talking really with your doctor and making the best choice for you. We say that women ages 21 to 29, a Pap test every 3 years. It changes when they get to age 30, where it's going to be that HPV and Pap test every 5 years, or the Pap test every 3 years. And women over 65, if they've had continuous negative tests, can discontinue their testing. So this is one where the recommendations have changed recently, and really talking with your clinician about the best options for you. So Angie, I'm going to turn it back over to you. I know we're short on time, and take any questions, or there is my contact information. Please write it down, email me, call me if you have questions or want any more information.
Thank you, Beth. That was a lot of great information, not only about cancer prevention and incidence, but I also appreciate knowing how we can get involved. I think that's something that is sometimes in the back of our minds, and so that information may prompt some to get involved. So thank you for that. If you do have any questions or comments, please feel free to use the chat box feature on your screen. And we do have a few questions already, Beth. One is, how are e-cigarettes impacting tobacco use in Wisconsin?
Yeah, really interesting question. It is something that they're doing research on right now because it's such a new development. I will look and see if there is anything that's been published yet. I don't think there has been specifically here in the state of Wisconsin, but I'll look into it. Feel free to email me if you want me to provide a response, but I have not seen anything published on the impact of e-cigarettes in Wisconsin, but I can do a little bit of digging and see if there's anything published yet.
Great, thank you, Beth. Let's see here. Another one is, are there guidelines for checking for lung cancer if you live with a smoker? So this one is referencing secondhand smoke. Do guidelines change depending upon your living situation?
Yeah, you know, they haven't issued guidelines for screening for individuals that may have that secondhand smoke exposure. I would say talk to your physician and really see what your exposure has been. Usually guidelines come once there's been a study done, and so that's where the National Lung Screening Trial was over several years, and it was following smokers. I haven't heard the same research being done on those that may have been exposed to secondhand smoke, and so then I haven't heard about any guidelines coming up. But I wouldn't say that should stop somebody from talking with their physician if they really have had that long-term exposure and seeing what the options might be for them.
Thanks, Beth. Let's see here. Are there common signs and symptoms I may have if I have cancer but I haven't been in for screening? So this one getting at, are there something that's kind of common that I should be looking for when I'm noticing that something's off with myself? It's just not the same day-to-day norm?
Right. Well, I mean, if there's anything that's alarming you that you don't feel, I would say check with your clinician. There definitely are some things with specific cancers we can look for that maybe if the cancer has progressed a little bit, and a lot of times cancer in the earliest stages won't show signs. So that's where we really want people to get in. So a mammogram is going to pick up a breast cancer before it can be felt. So that's where it's that earliest stage and can provide the most opportunity for treatment options. And that's really why we encourage people to get screened. So if somebody is, no matter what it is, I would say even if it isn't cancer, if there's really making somebody question, I don't know if this is right with me, to talk with their clinician, because there definitely are some things, when we look at colon cancer, or, if you're coughing and, there's something isn't right, can lead to, have you developed a lung cancer. As I said, the breast tissue, if you're seeing some changes or noticing changes there, those are all things specific to cancer, but I would say unless there's a specific example, really talking to your clinician would be the best option.
Thank you. Our last question for you, Beth, is, are HPV vaccines only for women?
You know what? That's a really interesting question. So the American Cancer Society right now only recommends the HPV vaccine for females. But I know that it has been approved in males as well. So really with the HPV vaccine, the importance of the vaccine is to get the vaccine before somebody becomes sexually active, because it does not remove the disease, it prevents it. So you need to have it in your system, the vaccine in your system, before it becomes sexually active. So really we recommend at that preteen age, so we're looking at 11, 12, 13 years old is where we recommend getting the vaccine, all the way up until age 19. It is approved for women all the way up to age 26. So it can be given all the way up for women up to age 26. But kind of the recommendation is to really to get it in those early ages so that you have that lifetime protection. But yes, it has been approved in men, but I don't know if there's a recommendation for screening yet, or a recommendation for the vaccine yet in men.
Oh, wouldn't surprise me. Things are always changing in the medical field. So
right.
Stay tuned. Great. Well, thank you very much, Beth, for being here with us today and sharing some great information. I know we all appreciate your time. And I want to thank our viewers for participating today. We hope to see you at our next Life Focus webinar. And please remember to keep in mind the short evaluation following today's webinar to let us know what you think. Until next time then, I hope you are all well, and we look forward to you joining us next time. Have a great afternoon.